Good afternoon. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I wanted to talk to you this afternoon about bonded blocks and their use in orthodontics. I've got several cases on that, so we'll have 6 or 8 videos on bonded blocks and different things that they do. So this case that I'll show you right here has a double crossbite. You just don't see very much. I think a lateral's out in front of a upper tooth, and the upper tooth's in front of a lower tooth, and that's in front of another tooth. And you couldn't hardly make the model without breaking the tooth off. So it's an unusual deal, and we put a block on one side to elevate that so that we could correct the crossbite. And I want you to look at what happens to the teeth on the other side of the mouth where we're trying to work on this crossbite on the right. I think the crossbite is on the left side. So let's get started here, and I'll show you some of these things. This is he's got good looking hair, doesn't he? And he smiles, and you can see this crossbite. It doesn't go ahead. He had a lateral tooth, you see, out here in front of the upper central, and the central's in front of the lower lateral, and the lower lateral's in front of the upper lateral. So it's a kind of a double crossbite. So I'm going to have to bond something over here, open the bite quite a bit to able to even start getting this crossbite fixed. So here's what we did. On the other side of the mouth, he's missing a tooth, and so we were going to take a 6-year molar out on the bottom and pull the second molar up into here, and he's missing the first molar here, so we'll bring this second molar forward, and we can fill in with wisdom teeth. Now the guy, we never did get to finish him, but that was what we were planning to do in here. So on the other side of the mouth, the same thing. He's missing his upper 6-year molar, so he's got a good wisdom tooth back here. So we're going to slip that upper first molar out, and we'll go in and slide the teeth forward and close this. And this was 1985 when we did that. Now we started doing that back in the 70s, though. But you can kind of see where we broke this tooth off over on the side. You just couldn't make a model without breaking them like that. So anyway, from the top you can see these two teeth lined up right in here, and I'll show you these spaces opened up in between here, because when he lost this tooth, some of this moved back and these moved forward a good bit. Now we're going to plan to bring these all the way up and close all this up and catch this crossbite and close that together. He left the practice, and I never could find the guy to go and before we finished, but we got most of the worst of the case over before he just disappeared. And so there are those the 6-year molars on the bottom we're going to extract, and you can see, and he's missing these, so we are planning to bring these forward and close this, and then we'd bring all of this forward and close all the spaces in that area there. So that was our objective. And going, and he's age 17 at this, and this is, I can't get the date on that real good, but here's the crossbite now. Okay, so we come in, and he's missing, we've had the teeth out down here, so we just bonded this block right across the top of that, and that slows up the movement of this tooth in there. That's what I don't like to do. It's probably, if I were doing this over, I'd leave the lower 6-year molars in until I got a part of the way down the line there. So anyway, here it is. We put the little arch wire, little flexible arch wire, and these are those winged bands that rotate real good, except for the four anterior bands are just plain double barred brackets there, and we're opening a space for this tooth to come through and pushing these teeth back and making room for the lateral to come through, and then this also will go through here. Now here's what happened. We bonded this block. It's hard to see on this picture. It looks like a 1/4 inch thick back here before we had room to bring this lateral forward. So while it took us several months to get that tooth across there, I mean about 2 or 3 months to bring this tooth across, so during this time we've already done a good bit of it, and these teeth are held apart over here about 1/4 inch, and these on the other side touched. They got together in about 2.5 months. He was able to chew on the right side of the mouth when we had these blocks on the left side of the mouth. Now that was amazing to me. I mean, that how much the teeth erupted together while this was staying apart. Then when we got the teeth over, we took the blocks out, and this came together, and the occlusion leveled out in here, and then he moved away. But I'm going to show you how this does, and this was amazing to me. I mean, he bonded blocks over here. This bonded to the lower, and he can bite on the upper right here. And before we got both these teeth across the bonding line, these teeth were touching on the other side of the mouth. Now that was amazing to me. And then when we got across with everything, we took this out, and we had a space over here this large, and it closed together, and the whole thing levels out. You don't even have to touch it. And I remember when I was in dental school, you could put cigarette papers between your teeth. You could feel the difference in there. All right, here's the upper, and we're bringing the lateral forward. There's how we did it, then with a spring. This was back in 1980 something. And there's the block pretty plainly visible right there. And then I had to put the block across the gap between the we had the second molar and the first molar we took out right here, and it's on the bicuspid. So the block is just kind of like a bridge. Now while we're doing that, we've closed this halfway up over here on this side, so we're going to be behind when we take that off. And that's a little drawback, where if you want to remove the teeth, it'd probably be best just to remove them both at the same time after you're through with that, but that'd take more time. All right, sir, we're back in this position. That's a poor picture right there. But back then we had to send them off and take what you got. And here we're putting that other tooth in. You can see the line, it's bringing them up, and it'll have more torque on it. So, okay, we got the tooth across the line, and we took the blocks out. And you see what a gap. I mean, it's about looks like 1/4 inch in there. That these teeth are higher up than the ones on the other side of the mouth. Now sometimes if you didn't know what would happen, you'd be thinking this is real crazy. You're going to have to send him into a surgeon to get it straightened out. And don't do it. Just hold on a minute, and let's watch these teeth come together. Now here yours about halfway together, and we've got the crossbite settled, and we'll start closing the space. He's got one contacting right here, but we bring it on out and bring it to the occlusion levels out, and the teeth line up, and now we've got this space closed too. It doesn't like too much. They'll get both of those together, and we'll have the second molars up here and the wisdom teeth filled in behind, and you got to have a full set of teeth when he gets through. Well, he took off. They were behind on their bill, and they just disappeared. And we wrote letters and everything else trying to get in contact with them, but we never could find out. But actually, we had finished the case down to the simple part of just finish moving these molars up and filling in that space. And I don't know where the guy ended up, and whoever he went to was able to do that. But thank you for watching. But the thing that I wanted to point out in here is that you'd have a gap on one side and the teeth would be together on the other side, and when we took this out, these teeth closed together the same height as the other teeth closed in there. And that's the amazing part. We're going to show several of these videos with how we use these blocks in orthodontics, and show you how to take them on and put them on, take them off and everything. So thanks for watching, and I'll just close out right here and see if we can shut this thing down. Thank you again, and I want you to subscribe to our channel. Thank you very much.